My name is Kristen Schneider. I'm an assistant professor here in the Department of Psychology at Rosalind Franklin University. I'm a health psychologist by training, which essentially means I'm interested in the interconnectedness between our physical and our mental health. And so I work with a lot of people on weight loss and behavior change to help prevent disease.
My name is Jamawid Mazer, and I'm a physician assistant. So my role at Rosalind Franklin is I'm the Associate Program Director for our PA program here, and I also work as a physician assistant for the Rosalind Franklin University Health System on the Community Care Connection Mobile Health Unit. So as a physician assistant, we are able to take a history and physical of our patients. We're able to then determine if they need any labs or imaging for their condition. And then we developed a differential diagnosis, hopefully eventually arrive at a diagnosis for that patient. And then we treat our patients. So we provide pharmacological treatment if needed or other modalities of treatment as needed.
I'm Dr. Jeffrey Domashki, and I'm a physical therapist. I teach in the Department of Physical Therapy. Physical therapists evaluate and treat individuals, and then we use a variety of different techniques to help patients out. It may be exercise sorts of activities like strengthening, stretching, aerobic activity, cardiovascular activity. We may use things like manipulation or moving their joints. We may use other sorts of things like physical agents like ultrasound, hot and cold. So physical therapists use a variety of different techniques to really help people get moving. We're movement experts, and we really want to get people back to moving.
One of the first things that I would let someone who's been recently diagnosed with diabetes know is that this can be a very overwhelming and stressful time in your life. With type 2 diabetes, to get that diagnosis, oftentimes you're required to make a lot of behavior changes that can be pretty challenging. There's a lot of information that's being thrown at you. And so if you find that you're feeling stressed or overwhelmed, that's completely understandable. And when you're feeling stressed and overwhelmed, one of the best things that you can do is reach out for support. And certainly that can come from your medical team, so talking to your physician or the nurses about what resources are available to you. There's a lot of great diabetes support groups in the area, as well as online. The American Diabetes Association has resources, people that you can connect with who also have type 2 diabetes to get information about how they've handled their disease and what suggestions they would have. And other thing in terms of getting support that I would encourage people to do is to reach out to their own social networks, so the people in their life, family, friends, that could be a resource for them. It's sometimes hard to ask for help, but it can be so important at a time like this to let people give you the kind of assistance that you need.
So when you're diagnosed with diabetes, one thing that you want to keep in mind is that you might have had your relatives or your friends that were diagnosed with diabetes, and you saw their progression of disease. But I think you have to realize that you are your own person, and the way that diabetes will affect you, the way that diabetes will be managed for you, will be individualized. So it will be based upon your specific condition and what your clinician does for you. So diagnosis of diabetes carries a lot of responsibility with it, both on the clinician's part, but also on your part as a patient. And so we're partners in your treatment, and it will take some work on your part in order to maintain good diabetes management. And I think that's an important point to take home. There is a lot of organ systems that are affected by diabetes itself. So we will be watching to make sure that we control for those, and we might involve other healthcare professionals in order to help us to do that.
So with an individual who was just recently diagnosed with type 2 diabetes, the main thing I would really tell them is if they are moving or performing physical activity, to make sure they continue to perform that physical activity or maybe even increase that physical activity. For somebody who was just recently diagnosed with type 2 diabetes and they're not moving, I would say you need to get moving now, because movement is really important. Physical activity is very important. So that would be my advice.